yields. The chair now recognizes Mr. Auchincloss for his 5 minutes of questioning.
Thank you, Chair. I appreciate the opportunity to weigh on this important discussion. The United States and peoples around the world indeed face emerging bio threats, and appreciate the testimony of the witnesses here, particularly Mr. McKnight, who I'm proud to say is a constituent, and Massachusetts is certainly proud to have Ginkgo Bioworks founded and operating out of our state. And I served on the Select Committee on China last term. I've got significant concerns about biology as the sixth domain of human conflict and the Chinese Communist Party's willingness to weaponize that domain. I tend to agree with Mr. McKnight that any domain that can be weaponized in the field of human conflict ultimately will be. Yet, regrettably, I believe the biggest threat to global health right now is not coming from the Chinese Communist Party. It is the reality that the United States Secretary of Health and Human Services does not believe in the germ theory of disease. He has repeatedly, over the course of his career, said that the germ theory of disease, which might be the single best supported scientific theory of biology of the last 200 years, is spurious. He favors what's called terrain theory, which is the concept that your body gets sick because of an imbalance of humors within your body, and microbes take root in your tissues to clean out the bad stuff. We are trying to prepare for a future in 2050 of pathogens, both accidental, natural, intentional, with leadership that believes in a theory that would have been out of date in the 1850s, before the United States Civil War. It is an embarrassment to the American public. Dr. Havers, you had to work in an environment created by this kind of quackery and conspiracy. Could you speak about the culture it creates amongst scientific experts at CDC, at NIH, at FDA, when the leadership of HHS rejects foundational science?
I mean, it makes it impossible to work, and I think that that's why we've seen such a loss of expertise at all these federal agencies, either voluntary, in large part voluntary, because they could not tolerate being under a leadership that regularly espouses unscientific nonsense, frankly. And I think that as a science, these are nonpartisan agencies. Like CDC historically has only had one political appointee, and people have worked under multiple administrations without interference. See, people in these agencies care about science and care about data, but it is incredibly demoralizing when you see the agency that you've dedicated your career to weaponized to spread unscientific and dangerous theories.
Can we prepare for future pathogens using a terrain theory of disease?
Absolutely not. No, of course not. I mean, we need to have people that actually know what the science is and understand basic science and leadership.
Also had to work under Mr. Brad Smith, is that correct?
Yes, I mean, I didn't directly interact with him.
But you were working there when he was running Doge Healthcare.
Yes.
Now, Mr. Smith now has gone from running Doge Healthcare to the State Department to run global health. When he was at Doge for the US Health and Human Services, and I want to build on the theme from the gentlelady from New York here of corruption, Mr. Smith had a private firm, Main Street Health, whose biggest investors were the biggest health insurance corporations in America, all the biggest customers and providers of health insurance under Medicare Advantage. He then was put in charge of Medicare through Doge and proceeded to increase reimbursements for his own investors and cut the regulations of these Medicare Advantage organizations. Rewarded for that behavior, he is now running US Global Health at the State Department. Do you think our allies and people overseas can have confidence that Mr. Smith is going to execute in the interests of global health or in the interests of his investors?
I don't know. I don't have personal knowledge of Mr. Smith's dealings, but I will say that the scientific credibility of the U.S. abroad has been incredibly damaged. People are looking with horror on what has been done at NIH, FDA, CDC. I do think that we do not have the leadership in place that has the integrity and the best interests of the American people at heart at the moment.
Do you think it would help our credibility if Congress would do oversight of RFK, of Mr. Smith, and of the other chieftains of U.S. healthcare right now?
I think so. I mean, I think it's very much needed. I mean, for example, Secretary Kennedy has basically run roughshod.
Gentleman's time has expired.
I yield back. Thank you, Dr. Hippers.